afternoon, everyone, and welcome to this webinar. I'm Lois Takahashi. I am the Houston, Florida Professor of State Government at USC Price in Sacramento, where we deliver a Master of Public Administration degree targeting full-time working professionals. It's my privilege to moderate this panel of exceptional health equity leaders. So I'll first briefly introduce them. Then we'll have a discussion among the panelists, and then we'll address as many questions from you as we can. If you can see the Q&A button at the bottom of your screen, please use that to put in any questions anytime during this webinar. We'll get to as many questions as we can, and we'll hold a little bit of time at the end for questions in case those come up. So before we get started, I would like to thank Giovanna Quiros for her expert technological support and help in organizing this webinar. Let me go through and introduce our panelists. I am just so happy that we have these leaders here today, not only because they have a lot to say, but also we're in a very interesting time, full of interesting issues that we have to deal with. And I think the conversation today will help us understand how we might do things, both in our small scale way and maybe in larger scale ways. So first, let me introduce William Jahmal Miller. I don't know if you can see this. Oh, of course, it doesn't show up very well. The author of Equity, Equality, and Justice for All, and really, as I read this book, the motivator for us having this conversation. He's also Chief Administrative Officer of the Mercy Medical Group of the Dignity Health Group, which is very hard for me, Jamal, to say. But in his role as CAO, he strategically leads Dignity Health Mercy Medical Group's organizational development, health system relationships, talent management, and business operations. He received his Master's of Health Administration from the University of Southern California, and Western University of Health Sciences awarded him an honorary doctorate in humane letters for his achievements in the field of health and human services. So thank you, Jahmal, for being with us today and for writing this wonderful book. Michael Valle is Deputy Director and Chief Information Officer of the California Department of Healthcare Access and Information, or HCI, where he oversees data analytics and technology. HCI expands equitable access to healthcare for all Californians and is a leader in health data, transparency, and evidence-based analysis. He's led the implementation of various data transparency programs, including hospital supplier diversity in 2021 and prescription drug reporting in 2018, among many others. He received his Master of Public Administration from the University of Southern California Price School in Sacramento. So welcome, Mike. And last but not least, LaVonna Blair Lewis is professor and vice dean at USC Price, where she directs the initiatives of the Price School concerning diversity, equity, and inclusion. Her research focuses on cultural competency and health status and the needs of underrepresented groups. And she just completed a project on racial disparities in cardiovascular disease and diabetes through a project funded by the Centers for Disease Control and Prevention. So welcome, LaVonna. Thanks for being with us today. So let me first start with Jahmal. The book is really interesting. It kind of goes back and forth. It uses biography, history, organizational history, and these different sort of flashpoints in the public and in government in terms of bringing attention to health equity. So can you tell us a little bit about what motivated you to write this book?
Yes, thank you for the introduction and thank you for the opportunity to just share today and have a great conversation about a topic that I'm very passionate about, both personally and professionally. And I've often gotten asked the question as to what motivated, me to write this book. And, I kind of surprised myself because after graduate school, after finishing the MHA program, I committed myself to not writing anything longer than a long email. And about midway through my career, I really got the inspiration, particularly when I was at the Office of Health Equity, to really start documenting at that time what I felt to be a very exceptional experience, being California's first ever health equity officer, and that being a culmination of a lot of what we studied in graduate school and a lot of what I lived throughout the course of my life. And it was something very unique and distinct about that experience to where I felt the power of storytelling through writing was important. And particularly as it centers on health equity, a lot of inequities exist because of disenfranchisement of marginalized communities. And a big part of disenfranchisement is that people who are in power and who have privilege they control the narrative. So I felt that to preserve legacy and to really share my experience in hopes of enlightening and educating and inspiring others, that I would put pen to paper, and others came alongside me to really help motivate, inspire, and get that project across the finish line. So I think documentation is key to telling our stories, not just telling our truth, but really telling the truth about what it takes to achieve and realize health equity here in the United States of America. So that was one of many reasons that I was inspired to write this book. And I'm very, very grateful that it's out there. I can say that I'm an author now, and I'm hopeful that it will continue to have an impact and inspire others to be an advocate.
Thank you so much for that, Jahmal. And for those of you who want to buy the book and you haven't bought it yet, and I don't know why you haven't, we're going to put in the chat box a link where you can find the book. It's a very compelling read too. It's not like something I would write where you'd probably have to look up every word in the dictionary. It's a very sort of storytelling, as Jahmal's saying, very narrative focused piece, which I think is why it was so compelling. And so maybe I'll ask Mike next. Mike, as you read this book, and there's a lot to unpack in here because it goes back and forth. It's sort of this kind of uses the anchors of current events, but also his history to kind of walk us through what equity is like and where inequities come from. What sort of stood out to you, Mike, as you read this book?
Well, thank you so much, Dr. Takahashi. And first, I just have to say that it's an honor to be here. And Mr. Miller, I followed you from a distance over years, and it was wonderful to get to share in your story through this book, and truly an inspirational piece of work. And Dr. Lewis, my professor and mentor, everything that you taught me, always pushing me and everyone to stay focused on making improvements. I just want to say just how humbling it is to share the virtual stage with all of you. But this is really fantastic work, and I think some of the things that struck me coming from the government administration space, the civil service space, my roles in data technology and research, that frames a lot of my thinking. But a colleague made the statement, and I don't know if they came up with this themselves or not, but it really struck me in that our government, the United States government, started off as intentionally inequitable, unquestionably, and then perhaps became unintentionally inequitable. But now it's time for us to be intentionally equitable. And as a trained political scientist and student of public policy, that stuck with me, that government is supposed to have a role in protecting the most vulnerable in our communities, and that we have not done that collectively, and we have not measured up to those ideals. And so that's the charge. And so I think connecting that with Jahmal's book, what I really took away is to be self-critical as an individual. He talks about being a natural advocate and being intrinsically curious, and certainly as a public servant, what can I do? And asking that question, what am I able to contribute? And I think probably for many of us, and I think again, reading the book inspires even more to realize that we can do more than we thought. And for civil servants, how can we intentionally be removers of those institutional barriers to equity? And Jahmal points out vividly many of those in the healthcare field, but ultimately there's I think a personal commitment to look inside yourself. And again, I just want to commend Jahmal for putting his life and story out there for the world, because I think it's really a tremendous piece of work for us all to learn from.
Thank you, Mike. And that is very true that, Jahmal, you're very much in this book. I mean, your life, everything you've been through. I mean, it's kind of an amazing thing to put yourself out there. Let me ask LaVonna, because you've been doing events about this book since it came out. What do you take away now, and what do you unpack from this that, today versus what you were talking about a few months ago?
So I'm glad we started off talking about the importance of sharing our stories. And when you think about someone sharing their stories, there's a recommendation that you look at it through a window and a mirror, right? Window, maybe these are things I've never seen before, never thought about before, and a mirror in terms of these things I've seen before and they resonate with me. And so I'm gonna I'm going to give a little bit of both. And so this may sound strange, but the first thing that really, I guess, just kind of grabbed me was this idea, since we're talking about equity issues, but this idea of premature death, right? And the fact that it starts pre-birth in some communities and just can get worse over time if we don't pay attention. DNA is not your destiny, but something has to change. And so physically, what we understand that, but I thought about it also in the context of the death of dreams and aspirations, because of the expectations that people have for different groups of people and the assumptions that they make about those people. And so things that may die on the vine simply because they weren't fed in terms of somebody's imagination and creativity. And so as an educator, what also stood out to me was this issue of literacy. And Jahmal talks about the trips to Cuba and the fact that you can make literacy a priority. And the fact of wanting people to know, irrespective of their income or other kinds of things, wanting people to be able to read and understand things that are important for them to know. I also kind of picked up on the kind of, I talk a lot about talent being everywhere, but opportunities aren't everywhere, right? And so to listen to what happens when they're both in place, right? To have someone that's qualified and who has the support to use those qualifications to do great things. And so I appreciate it, those parts of the story where, again, these things were happening because of relationships, because of connections, which are so important, because again, it's like people need to know, you need to know who the people are that can move things. And if the people who need to be known, no one is sharing their name in those spaces, we get what we always get. And so I appreciate that. And then the last piece is really that same idea of, having to be the only so often, right? And so being the only one in the room that may have a different lens, they may have a different set of perspectives. And so being the only in the room, I think Jahmal mentions it, as a person of color, sometimes the message is that you're a sellout, right? And so when you're the only in the room and you wholeheartedly support the status quo, maybe you are a sellout. But in Jahmal's case, it was a focus on being an educator and a change maker, right? The fact that, well, now that I'm here, I think there are some things you folks don't know. So let me help you to understand, and not in a confrontational way, but just the recognition that if we're going to move the needle around equity, we have to recognize that there are consequences to what we don't know. And if we're not opening ourselves to someone educating us about those things, we'll continue to not know. And so those are the kinds of things that resonated with me. And the last thing I would say would be the faith piece, which holds everything together. So that was it for me.
That's great, LaVonna. Let me go back to Jahmal then and ask you, Jahmal. LaVonna mentioned a whole bunch of things that sort of you put forward as both challenging, but then you created a bunch of description about tactics that you used and ways that you got around some of these issues. Can you talk a little bit about some examples to share with our audience, maybe those who haven't read the book, and you can maybe share something from the book, but also in your current role, how do you push forward agendas on equity, equality, and justice to sometimes audiences that are not ready to hear that?
Yeah, absolutely. There are a number of examples I can give, and I think the common thread in the examples that I will give is how do we really fundamentally know what levers to pull from a power standpoint, to really affect change. And the way that I think about it is whether you're in government or you're in private sector or wherever you might be, identify with those policy positions, the economic or budgetary piece, the human capital, the people, and kind of the programmatic components. Those are like 4 key components that I identify with change. If you really want to change a systems for those that are more equitable and more just, you have to understand those fundamental 4 components. That's been a common thread throughout the course of my career. One of the lesser known quotations that is my favorite from Dr. King, Martin Luther King, who we celebrated recently his birthday, is a quotation where he says, "Morality cannot be legislated, but behavior can be regulated. Judicial decrees may not change the heart, but they can restrain the heartless. So one of the reasons why I really like that statement is because it demonstrates his understanding at that time, which made him a threat, as to how do you really mobilize people towards power and affecting change, and understanding from a constitutional standpoint, from a legislative, from a regulatory standpoint. If you really want to see change, you have to understand how policy works. So one example I'll give, was when, I was leading the Office of Health Equity and really had a practical opportunity to work in government and to understand why it's so important for us to steward well that opportunity to serve Californians in an executive post like that. And our team was advancing policies and programs and budget and influencing and advising the governor's office on things that we really needed to do to be uncomfortable, to move legislation, to inform, regulatory interventions to affect change. And one of the significant areas of impact that we had by way of a demonstration was a $60 million investment that we moved forward to address mental health disparities in California. And to some extent, it's a drop in the bucket, but it was a demonstration project to show how can we use socially innovative efforts that aren't mainstream to show that culturally competent and more linguistically appropriate mental and behavioral health services work above and beyond, or in addition to kind of some of the mainstream mental and behavioral health services, because there's a history by which those traditional services often have not served marginalized communities well. So our investment in those community-based programs and to innovators throughout the state of California helped us to really elevate how phenomenal these practices were, but we also had it evaluated by our partner at Loyola Marymount under the leadership of Dr. Cheryl Grills. They evaluated these efforts, which weren't necessarily evidence-based, but we were able to demonstrate and show value as to the positive impact that could be had. That's one example of showing how change can happen and how it can inform the 58 mental and behavioral health departments across the state of California when we think about how can they reimagine how services are provided across the state of California to those who are often marginalized, underrepresented. And in my current role, quickly, being back in the private sector, part of the Common Spirit Health, Dignity Health system, one of our areas of focus right now is a peripheral artery disease prevention project. So peripheral artery disease, if left untreated, ultimately leads to things like amputation, cardiovascular disease, so on and so forth, diabetes. So we're focused now in partnership with Johnson & Johnson. We have a $250,000 investment into this effort to identify those who are at risk of developing PAD. And the advantage of that is that we want to disrupt this trend that we see of particularly African-American and Black patients, people in our community who often get unnecessary amputations and ultimately develop other comorbidities. We're trying to disrupt that cycle and go upstream in the pipeline. So I give those two examples of one squarely placed in the healthcare delivery system that I'm an executive sponsor for now in our system. And then I give the other policy-oriented one, which I tend to have a stronger bias towards that, because I think if we're going to change society, it gets back to this statement that Dr. King says, and closing out on my comment here. And again, he says, morality cannot be legislated, but behavior can be regulated. Judicial decrees may not change the heart, but they can restrain the heartless. So that's going to help us get across this finish line to realizing health equity and health justice. And hopefully those are two good examples that show what's possible.
No, that's great. And the idea that you go invest in sort of illnesses and conditions that people are not paying attention to as a way to bring attention to other things is a really, I think, innovative way to bring highlights and attention to things in a way that you don't usually do. So as LaVonna is saying, sometimes people don't want to listen. Well, if you come at it from a different perspective, sometimes that can open a door. So that's brilliant strategy. Let me get to one of our regulators at HCI. So Mike, I know HCI has been doing some tremendous work on trying to get information out to people in ways they understand. To build on what Jahmal was saying about, bringing attention to things, highlighting issues for people. Can you tell us a little bit about how this relates to equity, justice, and equality from HCI's point of view, and what you've been doing at HCI to try to bring more people into the conversation? And can I ask our team to post the link to the HCI website so that people can take a look at that?
Absolutely. Happy to do that. And of course, healthcare data has been used to identify disparities in the healthcare system for a long time. But what are we doing to address those, as was said? And I think I could share some of the work I've been involved in, not speaking on behalf of the administration today, but just some examples. My agency recently published a social drivers of health report that looks at preventable hospitalizations from a number of different dimensions, social drivers, so race, language, health coverage, status, access to housing, how those are presenting in the delivery system, the role of zip code getting beyond genetic code in terms of health outcomes and showing the disparities there. We're building a new equity measures program now that's focused on digging into disparities on clinical quality measures in the hospital sector, but also looking outside the four walls of the hospital and making that transparent to the public, but just making sure our data and reports are really centered around equity. And I think the transparency too, when we talk about making the data available to do that, that can show where there are gaps in the way we're collecting data and our data reporting systems and how we're classifying things as well. So there's room for improvement there. But I think in my role, it's really about bringing evidence to drive action, but also to do some of that storytelling that we've been talking about, trying to make that information come to life so that it can touch the heart and spur action. So in the reports that we're publishing, we're trying to shine a light on inequities and making sure that we have plain key language, key findings in plain language, takeaways that are front and center from what you're seeing in the data. And certainly healthcare is a complex system. So there are many of those levers that can be pulled, practices of care and standards for treatment and diagnosis, as Jahmal mentioned, that more culturally competent care is administered by providers that look like the patients in their community. And we have a report coming out soon that evaluates the supply and demand of the health workforce. But I think beyond the numbers, just focusing on how data can encourage the heart to act, whether it's changes in policy or targeting funding opportunities, or just creating greater public awareness of issues and what folks are experiencing, and validating that through the data and making sure that's part of the public policy debate. And there's certainly, again, challenges that we can unpack, but I think using transparency as a foundational mechanism to do that improves engagement and improves trust, and is an important step in the process.
And Mike, can you tell us a little bit about how you know that what you're putting out there is more understandable? Because we know that healthcare is very complex, as you all know, because you're all in this field. But how do you know that something's more readable to people?
Yeah, it's a great point, Lois. Part of what we do is we have an outreach and engagement program focused around data. So we're bringing our reports to focus groups, to survey participants, making sure there's diverse representation there, and then getting kind of a feedback mechanism going. And we like to take an iterative approach. We start small, we start simple, but with that feedback, how do we make sure this is something that's understandable? Because if it's not, it's more difficult to translate that into action. So that's what we're striving for.
No, that's great. And those of you on the audience, we have over 100 people on the webinar. So thank you all for being here. And as you are thinking about questions, please put them in the Q&A button box, whatever the technological term is for that. And we will get to as many questions as we can. LaVonna, so, you're dealing with both the research side and the teaching side and the community side, the faith side. I mean, can you give us some examples that get to some of these issues related to what Mike and Jahmal have been talking about, which is both the policy side, policy making, but also about this narrative creation? Because I know you're working very hard to help people narrate more clearly to others what's going on in the community.
Thank you for the question, and I'll just start with the recognition that I've been at USC for almost 30 years. I got here in 1996, and so I've had the pleasure of teaching students who are first generation students and students whose parents could write a $50 million check and endow the school and everybody in between. And so that is a tremendous opportunity to maybe not, you have a captive audience and can influence what people are thinking about 16 weeks at a time. And so when I was the director of the undergraduate program, we put social justice classes as part of the required curriculum, right? Recognizing that people will, in general, select out of spaces that make them uncomfortable. And equity, equality, justice conversations make people uncomfortable. And so I think in the classroom and in the work that I'm doing as a vice dean, helping people to understand the importance of building community, building relationships. It's hard to do harm to people that you know about, right? And so an appreciation for the fact that even though we talk about, we desire equality. Equality is about sameness, and you can't have equality if you don't have equity first, which is about fairness, right? And to recognize that everybody's not coming from the same set of circumstances, right? I mean, there are kids who are going to school where they're being taught by people who have emergency credentials, and they may not be qualified to teach the content. And then there are students who are coming out of spaces where they have AP classes, right? And so they're getting not just the basics, but the advanced kind of program. And so equity acknowledges that, right? And so I want people to start there, to recognize we can talk about, the need for these kind of programs going away, but there are these disparities still in existence, and the classroom is an important part of that. And I say that at a time when we're putting our fingers on the scale in terms of what people will know in their K through 12 education in a way that wants to homogenize the history of this country. And that has consequences. That gives us an additional hurdle that we have to prepare for in higher education. People may know even less about some of the policies that have supported some of these inequities. Going to Mike's point earlier, government has been involved in it. Jahmal mentions it, government has been involved in it. No, you can't legislate away racism or sexism or ableism, but you can't let people know that there are going to be consequences if they don't turn the corner, so to speak. And so the classroom, the things that we do that give people a chance to talk about what we don't know in a way that is non-judgmental, that doesn't cause harm, because we have apparently lost the ability in some instances to respectfully disagree. And so now we are tiptoeing around very tough issues. But again, literally, when we're talking about equity, health equity, we're talking about lives being on the line. We're talking about premature death and people thinking that everything is okay when there are, Jahmal mentions W.D. Du Bois in his book, and The Talented 10th. Du Bois wrote his dissertation on health disparities going back using 1890 census data, right, in Philadelphia. So these are not new. So we've known about them. And so I think it's important to acknowledge that. And so that gets to the kind of the research that you were talking about. Research has made it clear that these inequities do exist, right? But research that doesn't translate into action, is just, again, kind of reinforcing a message, but not moving the needle. And so for me, what's important for people to understand, what I think is important when you talk about these different audiences, is to lift up the different types of expertise. It's not just what the clinicians know. It's not just what the administrators know. It's also what the consumers and the patients and the community knows. And so long as we're trying to come up with solutions that leave any of the key voices out, we're always going to perform below where we could be, because, again, there's important information that hasn't entered the room because it hasn't been invited into the room. And so, and then the last thing just in terms of the research, is that I asked for a link to be shared, just in terms of an initiative going back to the things that are happening at the state, significant investment in the workforce, right? But also from a regional lens that is also mindful of inclusionary practices. So recognizing that government can play a critical role in terms of, again, saying what's important and what we're going to support. And so being able to share that with different audiences, I think is important. And it's also important to understand that different audiences need different things. And if we just have one playbook, we're going to miss a lot of people.
For sure. And, what's so interesting is that we're both trying to be more transparent, but we're in this context where being transparent sometimes gets us into trouble. We just saw a bunch of university presidents get fired. They're trying to be careful. I mean, it's a difficult time we live in, I think. There's a question that came through about that I think is linked to my next question, which is from Wing Yat Lam about what's the current sense of justice in the healthcare system. So maybe what I'll ask you is, what do you think are the biggest challenges? I'll start with Jahmal, to equity, equality, and justice in the health space, given what we've all talked about, but what your current sort of views about this are too.
Yeah, I think one of the biggest challenges in our major health systems, if you think the largest health systems in the United States, multi-billion-dollar entities, it's really no different than other similar corporate structures. And I think that the challenge comes down to this lack of just an explicit willingness to embrace and understand that institutionalized racism and discrimination is kind of cornerstone to what we know today as healthcare and medicine. Just like in our financial institutions, so many nuggets and jewels that Dr. Lewis just shared about our educational system, K through 12. When you look at our ecosystem within which we live, learn, work, play, and pray, and you look at the origin and the creation of our country, there's a lot of good to share. There's a lot of indifferent to share. And there's a lot of bad to share that a lot of folks don't necessarily want to understand better so that we don't repeat those same mistakes. So I think in healthcare, it's a similar dynamic. One of the reasons why we continue to see persistent disparities and inequities in health outcomes, in mortality rates, in behaviors, and the more upstream that you go into other social indicators, it's a common thread and a theme that many systems, many institutions, organizational structures that were created weren't necessarily created with justice and fairness for people of color in mind. So we were an add-on to some extent. So the extent to which we're making progress, and I agree that we are making progress, but not nearly as fast as we need to. So to accelerate and to strengthen those efforts, particularly within healthcare, we need to, invest significantly in workforce development. We need to identify the talent within our large, organizations and do what we can today. But we also need to understand that we need to maintain and have a sustainable commitment. What I like about what Dr. Lewis is sharing, and I talk about it in the book, is we called it this achievement gap, but specifically I've heard the governor and others reference it as really an opportunity gap. And that opportunity gap that exists within our K through 12 system, what that does is not only lend itself to educational attainment disparities, but it's literally stifling the pipeline to where it becomes a drip, drip, drip as far as who our future physicians, allied health professions, professors, hospital healthcare executives are going to be. So by the time you get to the end of that kind of continuum, the pool is shallower. And when you hear companies use that excuse as to we can't recruit more brown and Black physicians because they're not there, I would argue back and say that, yeah, we're there. The reason there aren't more is because if you look at the preschool suspension rate, where you're literally starting this unjust practice of mistreating our children early up cycle, and then we're surprised by the time we get to a shallow talent pool. So it's really this continuum that we have to see, that we have to embrace, and particularly in healthcare, make those investments now, embed from a governance and from a strategy and from an investment standpoint into your systems to affect change, but also make a commitment for the long haul. This isn't seasonal work. We got to this situation and it took us over 400 years. So for us to unpack to deal with the truth and the realities and the ugliness of this situation is analogous to what I saw this week in my neighborhood. Our landscapers on our street, I noticed that they're pruning back all the trees. And, what I like about that from an analogy standpoint is, they're pruning back and our trees are ugly and naked right now, but when they come back, they'll be thriving, more prolific, more beautiful than they were. And I think in this country, and especially in healthcare, we have some pruning to do, when it comes to misogyny, when it comes to racism, some of these other issues, we got to cut them. We got to get rid of them. We have to eradicate them. It's a challenging process. It makes us uncomfortable, but guaranteed, when harvest time comes, when springtime comes, we come back stronger, more beautiful than we were before. And I think that's a huge opportunity that we share. And I'm looking forward to when we can, really be about that good work.
I like this idea of pruning. It's kind of an interesting visual on, because we're always talking about fighting and, the kind of confrontational thing. And this pruning, pruning is kind of confrontational in a way, but it's also thinking about the future in a different kind of way. So thank you for that. Mike, let me turn to you. There's a bunch of questions in the chat right now about HCI. So I guess this is good. Everybody's interested in HCI. But then we have a question from Dr. James DeCarly over at Davis Gerontology. So thank you, Dr. DeCarly, for joining us. And they have a research project. They mentioned that 50% of materials that they were looking at in health education were misunderstood. And so he's wondering about cognitive interviewing, if you're thinking about that at all. We talked a little bit earlier about how do you know that something is accessible? And then there's another question about, is hchi.ca.gov open to the public? So I think people are thinking about transparency and openness, but also how do you know when people really understand what you're saying?
Sure, absolutely. And just to harken back to in this dynamic, I think in healthcare, if I can, I think there's a tension between competition and cooperation that presents itself. And so you have different entities all trying to serve a patient's health, but looking through their own lens and not always wholly aligned with the incentives. And I think with data, there could be a possessive attitude with that as well. These are my patients and my proprietary business information, and I don't want to share data, even though that could be helpful to the broader community. And so I think a truly all-in approach where individual interests are put aside in favor of shared goals. And so I think that means transparency. And we're talking about how do we measure the effectiveness of the healthcare system? How do we measure outcomes disparities? Making sure there are diverse lived experiences at that table of decision makers on selecting measures as well, and in the research and measurement space. So I mentioned our research, our outreach and engagement around data reporting. I'm not familiar with that methodology, but it sounds very interesting. I'd love to learn more about it. I also just wanted to say about the pipeline, because that came up as well, and I think it can be maybe inadequate to focus on the pipeline exclusively. And Dr. Lewis taught me that don't stop there. There needs to be accountability, up and down. But I think having a diverse workforce is really important. And Jahmal talks about inequities in the call center space. And I think, in government, we're talking about data. Do we have staff who, received food assistance, that have experience standing in line to receive benefits or losing healthcare coverage during their lives? Are they bringing a different lens to the work? Are they seeing patterns in data that others might not be seeing? How do different people use technology? The relationship with IT, people with disabilities, how do they experience our systems? Language access is incredibly important. Of course, now we're training our AI models. So where is that experience coming from? So I think diverse lived experiences helps us provide better government services. And just so going back to what we can do, I think that is important, that recruitment and that pipeline. Then just getting to the question of HCI data. So all of the data on our website is public, of course, and de-identified. So we're protecting patient privacy through statistical methods that make that data safe to publish. We also have secure channels for researchers to access non-public data to do longitudinal research and population studies through a controlled institutional review board process. And we'd be happy to share more information about that as well.
So everybody online, you know who to call. So LaVonna, we have a few questions from the audience about what skills do I need to know to change society? What kinds of skills should staff have to insert more justice into systems? I mean, what do you think about the learning environment and what skills these students and practitioners out there should be gaining to try to be more equitable, more focused on justice?
I will say that I think it's important for us to understand that we need both the technical and the relational, right? We are very comfortable teaching people how to do things. If these things are there, this is what you should do, right? We have less comfort connecting with basic humanity and a respect for people, no matter who they are. And that may sound simplistic, but I mean, I don't think you have to look too far to get examples of what happens when you discount people's humanity and dignity. I think that we could all, I think communication is critical. I mean, again, we have to recognize that some of the terms and the language and the tones that we use unintentionally may signal a lack of interest, a lack of compassion, a lack of understanding. So the words that we use matter. So for me, I think curiosity and empathy are both underrated. Curiosity says, I don't know enough. I want to know more. I'm opening myself to being educated. Will you help me? Right? Curiosity. How do we get here? Basic. The other thing is empathy. If you've never had to ride the bus to an appointment, you may be very frustrated when people are late to appointments, right? If you were close, but you couldn't get childcare, it never occurs to you that, well, I really wanted to be there, but I couldn't get there, right? Some basic things in terms of asking the follow-up question, caring enough to ask the follow-up question, rather than assume I know your story. Tell me your story so that if we can, do a better job, we've got resources, but if I'm not interested in how I might reimagine those resources, I'm not going to ask those questions. And so for me, I think that's the issue. People want a checklist, right? And the checklist is respect the dignity of the people that are in front of you. I did not say you had to agree with the people in front of you, but basic humanity, it's like I spend a lot of time just trying to get students to understand there is such a thing as being able to respectfully disagree. I can disagree, and for me, that's the issue. The fact that we don't know how to handle difference in constructive ways. So instead of handling difference in constructive ways, we've denied people's experience and their right to exist. We've discounted people's stories. We've demonized people for the choices that they're making and not looking at the communities which support those kinds of choices. And again, we end up with these disconnects because, again, for me, it's just something as simple as asking the question, what can I do to help you? Or what do you need? Because sometimes we assume without really checking in. So for me, it's just curiosity and being empathetic. Sorry, there's no magic toolkit.
Lois, can I double click on what Dr. Lewis is sharing? The public policy piece of our name as Price is extremely important. And I encourage, the MHA, the MPA, MPP students to understand from a public policy standpoint, who's holding and influencing that power from a federal and a state, standpoint. We're blessed in my assessment to be on the left coast in California, to be kind of trend setting. So when we think about a more representative government, I think we model where we should be as a country. But the reality is, and I'm looking at the statistic, non-Hispanic white Americans account for 75% of voting members in the new Congress. versus considerably more than a 59% share of the US population. And then you could break it down by gender, so on and so forth. So the extent to which our country is browning and tanning, and we think about the need to really build power, capacity, and agency from a local, state, and federal standpoint, that's extremely important. And I think from an academic, from a narrative, from a communication standpoint, from a technical standpoint, current students, and even those who are now in leadership positions or wherever, but particularly students, understand where the power sits. And from a public policy standpoint, start thinking about how do we change and transform that misrepresentation or the lack of representation, so that we have more equity and fairness in those positions. And it's not an accident that in places like Louisiana or Arkansas or Texas or some of these red states, that those state houses are dominated to where those numbers are, more egregious than the ones that I just mentioned from a federal standpoint. And it's not by accident. It's very intentional, in that those who want to hold on to that power and not relinquish it or share it with others, that's very important. And they're also making decisions as to what the curriculum is going to be in schools, what that narrative is going to be in schools. So I think that, to just double click on what Dr. Lewis is sharing, representation, demographic representation, and how can you influence a consistent and intentional effort to change who is making decisions on how 18 or 19% of our GDP is going to be spent on healthcare and human services. That's a federal level decision. And we have so many people who don't have practical and or lived experience sitting in those very influential seats. Districts have been gerrymandered. It's been very thoughtful and calculated as to how some of these things are set up. So when that happens upstream, it lends itself to what Dr. King would call a logical outcome when we see those inequities across every sector, every industry. And what has influenced that upstream is this public policy debate in this infrastructure. So we have to be present, we have to influence, we have to have voice, we have to have courage. And I think from an academic standpoint, that's what some of the students who are on the line, I would encourage you to approach it from that vantage point.
Courage is so important. And thank you for bringing in other places outside of California. We tend to live in this bubble here, and things are very different outside of California. So maybe Dr. Norris Gunby had asked the question about, he's new to California, what's going on in the South? Mike Valle, can you tell us a little bit about what you know about maybe about data and other things happening in other places? We know about the legislation that's kind of going forward in a lot of states about anti-DEI legislation, but what about health and health equity?
Yeah, thanks for that question. I think what I can say specifically about geography is don't be surprised in the diversity that you will see across rural and semi-rural suburban communities in California. I think it doesn't fit maybe the paradigm that you might expect. We have such a multiracial community in the state, and I think the data reflects that, and some unique patterns of migration that support that and that lead to unique healthcare needs and unique access to care, and it's very geography based. So focusing on place, I think, is right, and I think there's uniqueness certainly, and we're going to look a lot different, and it just, I think, spotlights where those challenges really are to meet the needs of those communities across the state.
We have a question from Maya De La Rosa, who's one of our alum, about what you think chief health equity officers can really do. I mean, so LaVonna, you talked to a lot of these people. So what do you think they can do in terms of pushing forward some of these agendas? And we'll ask Jahmal too, since he used to have this role.
Yeah, I think definitely Jahmal has more of the insider information in terms of answering that question. But I think diversity officers, no matter where they are in terms of industry, have a first of all, an obligation to make sure that they are comfortable making other people uncomfortable. Because so long as people are dealing with topics that make people comfortable, we're not doing our job in terms of the DEI space. Jahmal mentioned the fact that, you have to really understand that perhaps it's unrealistic to expect the people who may have to give something up to be celebrating the fact that they may have to give something up. But I don't think that that's necessarily the case. I think that there's enough available. I think Jahmal uses the piece in his book about the lighting of a candle, and you can, the candle isn't diminish when you take the time to light somebody else's, you get more light. And so I wonder if that's what we're afraid of. The fact that, some people may find out that they're really average because they have to compete in another space with people who've now been given more opportunities. And so I think for the leadership to recognize, number one, it's hard to get people to get excited about fixing a problem that some people don't even believe exists. Or if they do believe that it exists, they think that we've resolved all the issues and can now go back to business as usual. So again, I think you have to be willing to build relationships, ask tough questions, make people uncomfortable, and you have to basically recognize this is more LaVonna Lewis land moment than maybe anything else. But you have to recognize that no matter what you do, there will be people who are convinced that you haven't done enough, and people that are convinced that you've done too much, and everybody in between. And if that thought makes it's challenging to recognize that you will always be in that in-between space, it's no accident that people are stepping away from this work, right? Mm-hmm. I had a student actually call me and texted me and said he appreciated the work that I was doing. And when I asked him about it, it was basically because, that someone who was doing this work had committed suicide, and they wanted to check in and make sure that I was okay. Mm-hmm. This is the tension that we're dealing with right now. We have to be honest about it. I remain hopeful because, again, I think that the opportunity for something transformative is always there. But if we have people doing the work who are more concerned about keeping their job than doing the work, we're not going to get very far. So right. my comment would be fearless and recognize it's not about a popularity contest. It's about doing what you believe is right and dealing with the consequences.
Absolutely. And I would add to that, we have to be, I'm pleased to see the proliferation of chief health equity officer positions, whether it's in government, private sector, health systems. And a part of their, not only the DEI officer, the health equity officer, but really all leaders have to share in this responsibility to be very versatile in our language and understanding the audiences that we're trying to influence and empower towards change. And what do I mean by that? This work isn't exclusively moral and ethical. It's not just that, even though it is. It's also about what's the economic impact and the value proposition of achieving equity. And I think as a leader, we need to understand, again, those are other levers that we pull. Case in point, annually, the health savings opportunity associated with health disparities in our country is $300 billion. And if it stays on the same trajectory, by the time we get to 2040, it'll exceed $1 trillion. So if we're talking to a conservative audience or folks who don't want to acknowledge the problem, as Dr. Lewis stated, it's like, well, let me talk your language. Let's talk domestic security. Let's talk about our ability to compete on a global scale. Let's talk about the health and safety of our future workforce. And if we're browning and tanning in that particular cohort of our community, of our country, is being disproportionately impacted by inequities, that means in mind, body, and spirit, we're basically feeding a pipeline and having a guaranteed, very, very costly, both morally and economically, future. So the value add in bringing out of the blind spot, a lot of times we're not even measuring in our systems the impact, the cost of inequities. So you can't affect what you don't measure. And if you don't measure it, it's not important enough to you. So, and then the other thing that I'll say, getting back to that relationship piece, we cannot do this by ourselves. So how do we build coalitions, we build alliances, we bring allies along, and we share in this role and responsibility, because we run the risk as individuals being the only one. That's where that burnout comes from. We end up putting ourselves out there unprotected, unguarded. We oftentimes will get bullied. We're easy targets, but in uniformity with others, speaking in one voice, having the economic backing, the political backing, and the courage to do the right thing, we can move more quickly and more strongly. So those are that's my encouragement as to how we can really have equity empowered in public systems, government systems, private systems, and not see it as just some marginal, add-on, the nice thing that we do. We decorate it as nice ornamentation. No, this is about the security of our systems, of our people, and we need to integrate it in mainstream and make it a fundamental imperative to everything that we do, because it adds value. It doesn't detract or subtract.
I mean, I could go on and talk to you all for another 5 hours, but because we only have a few minutes left, let me go around the group. There's some really interesting questions in the chat about AI, about the upcoming election in 2024. I mean, everything that you can possibly think of in your life touches on this issue. So let me go around the room, though. I know these are big things we're trying to achieve, but what are some small steps people can take? Let me go around the group and think about, you don't want to write a book. So maybe you should. Maybe there are things you can do. Mike Valle, let me start with you. I know I hate to put you on the spot, but what are there some small things people can do that they can hey?
Sure. No, thanks. I'll just go back again to being self-critical and checking blind spots. I think we've also talked about building connections and just being intentional, I think, about building relationships with people that are different from you, and really taking the time and committing yourself to do that, being present in those spaces, leaning back, allowing presence in your space. And I think that's something we can all do.
That's great. LaVonna, what are some small things people can do?
So I would say pay attention to who's in the room and who's not in the room, and be willing to ask why. Also pay attention to who's being heard, again, asking why. And to recognize again that the silence is what allows us to perpetuate toxic spaces, right? If people know that no matter what I say or do, there won't be accountability to it, they'll just continue those practices. So pay attention. Don't just be what they call a bystander, be an upstander. We're always looking for somebody else to speak up. And I tell my students that if you're sitting there thinking something needs to be said or something needs to be done, you've been deputized, because you're the only one that may see it that way. And so you have an obligation to, again, just be more mindful. And hopefully, again, you have no control over how people respond to what you say, but you do have control over what you say. And if you think there's a problem, I think we owe it to one another to talk about it.
Thank you, LaVonna. Really good advice. And Jahmal, the final thing you want us all to go away with?
Well, just to answer the question specifically, I mean, it would be great. I would love for more USC alums and active faculty to have the book. That would be great. That aside, to respond to the question, in order for it to skate to where the puck is going to be, we've got to be disruptive so that we can get to scale. So I think generative AI, life sciences, biodesign, med technologies, health tech, spend a lot of time researching and thinking about how those kind of growing fields can be included as a new kind of part of our toolbox in this health equity journey. There's huge untapped opportunity and potential there, from wealth development, economic empowerment, new economies. And a lot of times they don't make it into our conversations around equity and social justice. So let's do some research in those spaces, get involved, and pull that into what it is that we're doing.
And just to follow up, the link for Jahmal's book is in the chat. I want to thank you all so much, Jahmal Miller, Mike Valle, and LaVonna Lewis, for such great insights, such great calls to action, and of course, being such lovely people. So thank you so much. Thank you, everybody out there in the virtual world. We appreciate you being here with us. And the recording for this will be up sometime soon. So please check out Price's YouTube video page. Thanks everybody so much. Have a great day.